name is Tia. I'm going to be your nurse today. Can you give me your name and date of birth, please?
Debbie Dallas. I have been born on 2/20/55.
Okay, Debbie. So today you are here because you suffered a stroke of your right side, which is affecting your left side. So we're going to be showing you how to use a cane today so you can perform, to maintain independence and perform your ADLs. Before we begin, I was going to ask you a series of questions if that's okay. Do you feel like you'd harm yourself or anyone else?
No.
Do you know what today's date is?
4/30/20.
Do you know who the current United States President is?
Donald Trump.
Okay, so also I'm going to go over your current medications. You are on warfarin for blood to thin your blood to prevent any further clots. With warfarin, you want to use a soft bristle toothbrush and an electric razor when you shave to prevent risk for bleeding. Also, you want to assess your body for any signs of bruising or bleeding and report that to your doctor if there is. Also, read food labels and minimize your intake of vitamin K.
Okay.
You are also on gabapentin for neuropathy pain related to your stroke. With gabapentin, you want to not stop taking that abruptly unless your provider advises.
Okay.
Also, do not partake in any activities that require alertness until you know how the medication affects you.
Okay.
And you can also take that with milk or food to prevent GI upset.
Okay.
We also did a lab test, and we were focusing on your PT and INR.
Okay.
Your PT is a normal range of 11 to 12.5. Your INR is also in normal range of 2 to 3. For anyone else, that would be elevated, but since you are on a blood thinner, that is within normal limits for you.
Okay.
Also, we did the MRI, and your results came back. There are no other signs of infarction or blood flow changes, which is good. So everything came back normal, and we're very pleased with your progress.
All right, thank you.
So we are also going to go ahead and move on with your physical assessment, if that's okay, before I show you how to use the cane. I would perform all general principles and safety practices. I'm going to go ahead and perform hand hygiene and put on clean gloves. I also have my gait belt for when I need to get her up to ambulate when using the cane. So I'm going to go ahead and put on clean gloves. I'm going to start from your scalp and move down, if that's okay.
Yes.
Can you go ahead and remove your glasses for when I make it to your eyes? Thank you. Okay, I'm going to start at your scalp and check for signs for symmetry, lesions, or lumps. Everything looks good on your scalp. I'm going to also palpate your sinuses. I'm going to feel for those and to see if there's any tenderness. I'm going to feel your lymph nodes for any swelling or tenderness as well. I'm going to go ahead and look at your skin as we go down for any signs of breakdown or anything like that or abnormal color. I'm going to go ahead and use my pen light to look at the color or to look into your eyes. I'm going to go ahead. Can you follow the pen? Have you had any trouble with your eyesight since your stroke?
No, I haven't.
Okay, I'm going to also check for light reaction. Okay, everything's normal with that. I'm going to look into your mucous membranes. Everything looks pink and moist here. I'm going to look up your nose. That's good. I'm also going to look into your ears. Have you any issues with hearing since your stroke?
No, I have not.
All right, there are no signs of drainage or lesions in your ears. I would look at both of those. I'm also going to perform a quick whisper test. So just repeat back to me what I say.
Whisper.
All right, good. So I'm going to go ahead and move down to your chest.
Okay.
Have you had any chest pain or discomfort?
No.
I'm going to go ahead and listen to or feel for all your pulses. I'm going to check in the carotid. Normal. I'm going to move down to your brachial pulses. Now I would do both pulses. Normal. You have good rhythm. All right, good. I would also move down her legs and assess color or anything like that, and I would also check for any signs of edema or swelling. I'm going to go ahead and feel her pedal pulse, and I'm also going to check cap refill on her toes as well. Is it okay if I check cap refill on your finger as well?
Yes.
Thank you. I'm going to check your chest for any signs of edema, check for tenting. Okay, good. I'm also going to listen to your heart sounds. Sorry, my stethoscope's not cooperating.
It's quite all right.
All right, I'm going to mainly focus today on your apical pulse. I'm going to listen to that for 1 minute. Is it okay if I lift your breast to listen?
Yes.
Okay, your apical pulse is normal S1 and S2. Okay, I would listen to all her other, her tricuspid and pulmonic and aortic pulse or heart sounds as well. I'm going to go ahead and move on to her lungs. Have you had any issues breathing?
No.
Shortness of breath?
No.
Sputum or cough?
No.
Have you had any issues breathing on your specific, since your stroke?
No, I have not.
Okay, I'm also going to oscillate lung sounds using the ladder technique. I would do this on her front and back and sides. I'm going to do it on your front today for this assessment. Can you breathe in and out for me real deep? Another, please. Another. And we do that in the full ladder formation on front, back, and sides. All lung sounds are normal, no signs of cracking, wheezing, or anything like that. I'm also going to feel for your chest expansion. If you could, lean over for me, and I will take a deep breath, breathe in and out. Okay, your chest expands normally. So we're going to go ahead and move on to your bowels. Have you had any issues having a bowel movement?
No.
Flatulence?
No.
When was your last bowel movement that you can remember?
About 10 minutes ago.
Okay. Was there any signs of abnormal signs like blood in the stool or anything like that?
No, it was just fine.
Okay, that's things we like to watch for where you are on a blood thinner. Have you had any issues urinating?
No.
No foul odor?
No.
Urgency or frequency changes?
No.
Okay, good. Or no blood in the urine as well?
Right. No. No, I'm sorry. No, I don't.
You're fine. I'm also going to look, listen, and feel on her abdomen for any signs of distension, tenderness, or redness. I would look at the abdomen first, and then I would listen to bowel sounds in all 4 quadrants. If there were no bowel sounds present, I would listen to all the bowel sounds for 5 minutes in each quadrant. Bowel sounds are all normal and active in each quadrant. Okay, so I'm going to also move on to your range of motion, which is where I'm mostly wanting to focus at today since you did have the stroke and it's affecting your left side. So if you could, grasp my 2 fingers. I want to feel strength. Your left side does feel a little weaker, which is expected since you had the stroke. Are you having any dizziness or shortness of breath or anything right now?
No.
Okay, because I do want to ambulate you to assess your gait when
Okay.
we do use the cane. Can you push against my hands?
Yes.
Pull?
Yes.
You are weaker on that side. I'm also going to do the same thing. Push against my feet. Pull. Okay. I'm also going to show you how to use the cane.
Okay.
I want to also, before we do that, can you move your arms for me? I want to see how. Okay. I'll do that on the legs as well. All right. So to use the cane, I'm going to go ahead and grab it. Okay, to use the cane, I would make sure that it's the proper level height for you. To make sure of that, I would place it next to your stronger side and make sure it's wrist high. I would also then place it on the side of the stronger leg and move it with your affected leg, like so. So we'd move with the cane. Also, I would like to, I'm going to use a gait belt and set you on the edge of the bed.
Okay.
And I would also raise you from sitting to standing slowly. So
Okay.
I'm going to use the gait belt and wrap it around you. And I'm going to stand you up slowly. Okay. So you're on the bed. And would you place your hands and push off with me and we will lift up. All right. 1, 2, 3. So go ahead and grab onto the cane on your strong side. And I would like you to take your leg, the affected leg, and move it with the cane. Yes, very good. Can you do that again? So your gait looks well with the cane, a lot better than without. Okay, so if you want to take a seat, do you feel comfortable with the cane?
Yes.
All right. Do you have any questions or concerns for me today?
No, that was very educational. Thank you.
You're welcome. So we would also like a follow-up appointment to see how you are doing with that. So I would document all my findings today. Everything looked good. You're doing very well. I would document and report and record. Thank you.